Do you think that there's any soft skills that you need to pick up in medical school and residency that aren't explicitly taught?
Oh, definitely. I think a big part of being a doctor is making your patients feel comfortable with you and making your patients feel like you're someone they can approach. One of the reasons I really love what I do is because I primarily see female patients. I specialized in women's urology and reconstruction. And so probably 80% of my patients are women, and they come to me because they like seeing another woman. But, I get so many hugs in my clinic and, a lot of, oh, I've never been able to talk to somebody about this problem, and like, you're understanding that. But, those soft skills are things like sitting down with the patient, looking them in the eye, looking like you're not trying to rush out of the room, like you're giving, even if your visit is short, making them feel like they're really listened to and that they're heard. Things like sometimes repeating back what you heard. Like, is this what I'm hearing you saying? And then for surgery, I think a big part of what we do is deciding who to actually operate on.
Right.
Operating, I can teach most people how to operate, but making the decision of who should go to the operating room is probably one of the hardest things. It's a little easier if you have cancer and you say, okay, you have cancer and you have to remove it. But even that has its nuances. For what I do, it's a lot of quality of life surgery. You really have to understand what the patient's expectations are, and is what you're going to do actually meet those expectations or make things worse. I have a lot of conversations with patients about their goals. And so I think those, having those conversations, you have to have the soft skills to be able to kind of navigate a patient through that conversation.